time for some homeostatic imbalances. When your joints don't work, you feel it. Some of the common problems are some cartilage tears. If you tear cartilage, the loose cartilage that's around your joints, we call those loose bodies, and they do interfere with joint function. They can cause your joints to lock up. They can cause your joints to give out. So a lot of people who have cartilage tears, they undergo arthroscopic surgery. Arthroscopic means joint. This is the prefix or actually the root for joint, and scopic means viewing. Scope means to view. And so you go into the joint and you just remove all the cartilage that has been torn. There's a picture coming up that shows you torn cartilage. A sprain means a stretched ligament. And so once you stretch a ligament, it remains stretched. Now, torn ligaments can repair themselves just a little bit if it's a small torn ligament, but usually if it's a big tear in a ligament, you have to go in and it has to be surgically. Basically, the ends of the ligament have to be sewn back together, and that's a daunting task. Dislocation, the fancy word for dislocation is luxation, and that's when the bones are out of alignment, and those bones have to be realigned. Subluxation is a partial dislocation. The bones are just partially dislocated, and usually partial dislocation is what occurs when people can put their bone ends back together themselves. The bones aren't totally out of alignment, and so they just pop their bones back into place. Now, bursitis, anytime you see the suffix itis, that means inflammation. Always it means inflammation. So it means inflammation of whatever word's in front of it. So itis of the bursitis means inflammation of the bursa. Tendinitis means inflammation of a tendon sheath. And if you recall, the tendon sheath is a substance, it's like an elongated bursa that goes around a tendon to prevent wear and tear on a tendon. And so when you overuse a joint, sometimes you'll get bursitis, sometimes you'll get tendinitis, and you just get swelling and redness in that area. And usually what you do is you rest it, you put ice on it, you elevate it, you take NSAIDs. Here's a nice picture of a torn meniscus. And they would go in and remove all of this area right here that's torn. This is a normal meniscus over here. The arthritis is a terrible disease. Itis, it'd be inflammation, and arth means joint. So arthritis is just a general term for any inflammation around a joint. You can have just a temporary arthritis, a joint swelling, but these are like gouty arthritis is actually usually a temporary reoccurring arthritis, but these are long-term joint swellings. This osteoarthritis is over time. You get wear and tear on your joints, and a lot of us will suffer from osteoarthritis or OA, more women than men, but it's usually what we call old age arthritis. Our cartilage gets worn down over time, and the bone ends, sometimes we can get bone spurs. The bone will start growing, and we just get a lot of pain in our joints. Osteoarthritis will usually affect one side of the body, it'll affect one joint. What I'm saying is it might affect your left hand and your right knee, but it's not going to affect both your right hand and your left hand unless you use both hands equally. In comparison to this type of arthritis, rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder. It's a very serious disorder. It does affect more women than men, and it tends to occur at a much younger age. That doesn't mean it can't occur at any age. There is a juvenile arthritis that occurs much younger, but between the age 30 and 50, it affects joints bilaterally, meaning if it's going to affect your right elbow, it'll affect your left elbow. If it affects your right hand, it affects your left hand, etc. And in this case, we have the formation of a pannus. And what a pannus is when the synovial membrane starts to become inflamed, synovial membrane is on the inner side of the joint. It starts to become inflamed and it will start sticking to the inner joint surfaces like the hyaline cartilage. And when it starts sticking to the hyaline cartilage, it will wear down that cartilage, and then the bone ends will start to grow, and literally the bone edges of the two joints will grow together until you get this right here, this ankylosis. And what ankylosis is, well, basically when the bone ends grow together and it's an immobilizing situation where your joints aren't going to work anymore. So this is total immobilization of a joint. And this is a devastating disease, and we don't know what causes it. There are lots of different theories. It could be a virus that triggers your immune system to go haywire. It could be a bacteria. It could be radiation. It could be, don't know, don't know. Lots of different microchimerism, lots of different theories here. So, but you don't want rheumatoid arthritis. Gouty arthritis. Gouty arthritis is the only one that's going to affect males more often than females, and that's because females can get rid of uric acid. Uric acid is the byproduct when we break down nucleic acids. Um, and so females can get rid of that more often than males. Uric acid will crystallize and build up in your joints. The big toe is a common site for the gout to form in, get the gout, but it can occur anywhere in any joint, knees, elbows, etc. So what they'll tell you to do is avoid certain foods that have a lot of nucleotides in them that will form that we have to break down nucleic acids that form a lot of nucleic acids, like for instance salmon, certain liver foods, certain organ foods, etc., and alcohol. There's a huge list that you can look up online that has a high nucleic acids in them that will cause you to form uric acid. So people who are predisposed to getting gouty arthritis, if it's in your genes, if you're genetically predisposed, you try to avoid eating those foods because attacks of gout follow your diet. Oops, let's go back. I wanted to show you this is ankylosis right here, and all through here. This is total fusion of the carpals, and here at the metacarpal phalanges right here, these bones are totally fused, so this person would not be able to move. That would be horrible. That would be devastating. Oops, sorry that happened. No, go away. Okay. Our last disease would be Lyme disease. Now, on Lyme disease, this is a devastating disease for your joints if you actually get Lyme disease. Lyme disease is carried by a little guy called the deer tick, little tiny deer ticks. They carry the spirochete bacteria, and this bacteria is not, if you get bitten by a deer tick, most likely they won't transmit the bacteria into you until they've bitten you for 24 hours. And so what you want to do is make sure that if you get a deer tick bite, that you remove the deer tick properly within 24 hours of being bitten. What happens if you do get the spirochete bacteria into you is what will happen is joint pain, and you might end up with neurological problems if you end up with Lyme disease. To get rid of Lyme disease, it's a very long course of antibiotic treatment to try to get it under control. So Lyme disease is a very bad disease for your joints. It's a worse disease for your nervous system. So this is showing you the bullseye rash. This is a very faint bullseye rash, and I chose this picture to show you how faint the rash could be, because there are pictures online where you could see extremely bold bullseye rashes, but I wanted to show you this one because you've probably seen this rash before. All right, that's it.